It's working now.
Okay, thank you.
Thank you, sir.
Yeah. So as I said, we are looking at behavior change communication and health promotion this evening. Good evening to everyone here. And it's becoming difficult for us to meet actually. Yeah. So we'll manage to meet each other halfway so that we'll be able to finish what we are supposed to do. However, today I was actually, Fridays, like in the morning, I have a free time. So I wanted to meet the weekend student today is possible, but I was told that that will not be possible. So here we are this evening. Everybody is here. So we want to look at this, and then subsequently, those one that we have actually look at in terms of health promotion and health system, and then research that they are not part of it. So I'll get time and then take them through as well, so that all of us will be on the same page before the semester come to a close. So basically, we are looking at behavior change communication. And if you look at it, you realize that a health promotion, as I was saying from the beginning of this lecture, the most important thing we want to achieve is what? We should change our behavior. So we are coming to look at how to use communication to change that behavior, to conform to the social issues that we are talking about, or to allow people to adopt healthy behaviors that will put them in a better place as compared to the condition or situation that they are actually going through now, or what you think you have identified in the community that you want to change people's behavior about it so they can adopt a healthy behavior that will make them better individuals within the society or the community. So an action an individual or community will voluntarily adopt based on their experience, knowledge, beliefs, attitudes, values, and environmental circumstances. That is simply behavior. So behavior is any attitude that anybody within the community is ready to what? Adopt based on their experience, their knowledge about it, their belief system, attitudes, values, and the environment. So you don't expect every, because this behavior is influenced by so many factors, so many activities within the community. And one of them is what? Your personal experience. And knowledge has to do with what? Education. And you remember I talked about how belief system that we have in our various communities also predispose us to unhealthy conditions. When you believe that widow who practices you must share the same bed with your dead husband or wife, you know the implications of those attitudes or those beliefs. And attitudes are also adopted free of charge, even though they are shared by the community. Individuals decide eventually which attitude to adopt. If you want to smoke, that is your life. It's a behavior you have adopted. If you want to drink and become a drunkard, which you know the implications of that behavior, that is what you have decided to do. And the values, we know them. How we value marriage, funerals in our community, and you know how this funeral can also expose that, and how we value naming ceremonies. But I also spoke to you about how naming ceremonies can eventually lead to a sharing of TB, where you are using the same glass, sharing drinks and all that. And we also know how funerals can also expose other conditions. We know how marriage ceremonies, especially when there are pandemic, how that can also put people at risk. And environmental circumstances. Sometimes people wish to adopt certain behaviors that they think that may be better for them, but because of the environmental circumstances, they are unable to adopt those behaviors. For example, you go to typical communities where there are no toilet facilities. People do not wish to go to the beach and do their own thing there. People do not wish to do it anyhow, but because the environmental circumstances do not support the behavior they want to adopt. So sometimes people adopt such behaviors because of what? Environmental circumstances or factors. So that is simply we are talking about behavior. That any action an individual community will adopt voluntarily, and that is based on what? The experience of the individual, their knowledge, and we can use that education and other things, the belief system, the chocolate, widow, witches, witch camp, and all those things, the attitude that they have adopted, whether they are eating healthy, they are smoking, drinking, the values of the community, how marriage, naming ceremony also count, and environmental factors. All of these factors shape the views of individual, shape the behavior the individual adopt, and shape how they do things within the community. So that's simply we are referring to as what? Behavior. However, when you look at health behavior, we are saying it's an action that an individual or community undertake to enhance or promote health, prevent diseases, detect early the onset of what? Diseases for appropriate action and compliance to what? Treatment. So clearly, when you look at this behavior itself and health behavior, you clearly see the change or the differences between the two. When you look at behavior in general, we are saying that you adopt that based on your own knowledge, your belief, your attitudes, and all that. But the health behavior, you are doing that as an individual community to enhance or promote your own health, prevent diseases, detect early, even when there is onset of all these diseases or illnesses, and also adopt appropriate actions, and also to try as much as possible to comply with treatment. You know, adherence is a huge matter. When it comes to adherence now, it's a big challenge. People have certain disease conditions, but they have to continue to adhere to the treatment. And yet, adherence is a challenge. If you don't adhere to the medication, you cannot get healthy. If you don't take predominantly, you don't take behaviors purposely to promote health, you will destroy your health. If you don't adopt behavior purposely to prevent sickness and diseases, and also to detect early, what are some of the issues that we can do? How do we adopt behavior that promotes health? We cease probably smoking. We stop what? Drinking unnecessarily. Or we also go ahead and do screening. That is early detection. If you have the disease, you can detect early enough. So you can also involve early screening. We talk about this all the time. Pap smear for cervical cancer. How do you call it? Breast cancer, both men and women. You can also adopt these strategies to detect early onset of these diseases. Screening is very important, and even how you comply with the treatment your physician is telling you also matter when it comes to the issues of this. So health behavior in a nutshell is a planned behavior of an individual so that they can remain healthy. You know, you go to function or there's a buffet, you have to go for the food you like. But you see diabetic patients seeing chicken, fried chicken there, seeing yummy food out there, you go and take something like kenke and pepper. Because what? He intentionally adopted that behavior so that he or she will remain healthy. Other than that, you go for what? Pizza and other things. But he's thinking about his or her health. So it's a behavior that you're adopting with a purpose of maintaining your health, to the purpose of preventing diseases, to the purpose of what? Live healthy. So it's a behavior that you're adopting basically because you want to remain what? Healthy. Other than that, you can go and drink to stupor. But you know that when you do that, you are destroying your health. So it's a behavior that you are not adopting for adopting sake, but for the purpose of maintaining your health. That is what we are referring to as what? Health behavior. Unlike behavior itself, we are adopting based on your belief, your knowledge in the community. You don't care whether they expose you to some health and healthy condition or not. So basically, that is the difference we are talking about when it comes to behavior and then also health behavior. So an individual or community, we expect individual to take behaviors that to promote their health. We are saying individual in a community because the individual, sometimes communities that we live in, they adopt certain lifestyle that become part of the entire community. And children learn by imitation. So when we do things that are unhealthy, they copy us, so it becomes community behavior. However, within the same community, you see individual, even in spite of that, they also adopt specific behaviors because they know their health status. They do not want to damage their health. They are now probably students. They want to protect themselves so that when they start enjoying their money, they will be healthy to enjoy the proceeds. Or when they start working, they can be healthy, enjoy their fruit of their labor. So that's basically about health behavior. And we are saying that when you look at behaviors that are health, behavior that are health threatening or health damaging, there are certain behaviors that you and I are aware. There are those behaviors, they threaten the health of the individual. They threaten the health of the community. And one of them we all know, unprotected sex with multiple partners. You know what you are doing to yourself. You know that that kind of behavior will put you at danger. There are a lot of transmittable diseases these days. Hepatitis B is a silent killer, it's there. HIV, we can't talk about it now, it's there. Over so many years now. So it's one of them. Smoking, we know, lead to what? Development of cancerous cells. People are aware, but they continue to smoke. Meanwhile, we know, drunk driving, when you drink and you are driving, you know, things that you are supposed to single, you begin to sing double. And you know where that can land you. But we see people are still doing it. Eating junk food. I always talk about this when it comes to food. Even 9, 11, 12 p.m., even 1 a.m., especially at our university campuses, you'll be sleeping, you get up to go to the washroom, at the floor, you get up. People are still waiting in the queue to get their Indomies at 1 a.m. And you ask yourself whether it's a breakfast plan, supper. You can't even differentiate. Meanwhile, when you eat things of that nature, you go to bed, it causes a lot of harm to your body because it does not digest as is expected. But we are doing it. This day, just that I want to take somebody out. Look at the kind of food they'll be requesting. You see, so we know that these are behaviors that are health threatening, and yet we are engaging in it. Meanwhile, the findings are there. About 80 to 85% of diseases that we have today is about lifestyle diseases. So communication may help us to change these behaviors so that we adopt healthy behaviors to protect ourselves. And this actually calls for what? Behavior change interventions. It calls for behavior change intervention. How do we intervene in their behaviors so that we'll be able to change so many things? It's called for behavior change intervention because we have identified the risk behaviors. So this calls for behavior change intervention. Some risky behaviors faced by young people, as we said: drug, alcohol, tobacco abuse, exposure to HIV and AIDS and other STIs, adolescent pregnancy, gender discrimination. These are some of the risky behaviors faced by young people. You know, young people, we believe that we even know sometimes better than our parents and all things that we learn in school. So we practice, we try to experiment drugs, we try to experiment alcohol and tobacco abuse. And exposure, that actually exposure to certain diseases that we have mentioned. Adolescent pregnancy is there because of the experiment. I was telling you recently in one of our studies that because of the lockdown with this COVID-19, a lot of young people were in the home, so they were experimenting sex. And as we speak now, about 109,000 plus girls were adolescent mothers in this country as a result of lockdown. They were not going to school, so they are in the house experimenting sex. And then gender discrimination, we know what it is. So these are some of the matters. So how do we change these behaviors? Behaviors that are possible to the individual or have become an integral part of the individual daily life are difficult to change because it's pleasurable, something that you enjoy. So it's very difficult to change those behaviors. So it's not an easy task if you want to actually bring about change in behavior. It's very difficult for somebody who enjoys that behavior to suddenly ask the person to change. You can imagine somebody who enjoys eating red meat, and the person is not diabetic, and the doctor is saying that you have to change and you don't have to eat again. It's not going to be easy. Even if he's going to die tomorrow, he will continue to do away completely. So change implies that saying goodbye to what you were doing. And I'm saying that it's difficult to say goodbye to things that you have enjoyed, you have liked, and become part and parcel of your life. 2, reaching a stage of what? Neutrality, where you can move to a stage where now, where you have gotten to, you don't want to go back, and also going forward become a challenge. It's always difficult to reach at that level. But when behavior change occur, we have reached the stage of what? Neutrality. And then preparation towards modification. You must also prepare how you are going to modify those behaviors when the change actually occur, or when the change is about to happen. You must also prepare to modify those behaviors, and also adopting the new behavior. First, trying to say goodbye to what you were doing, reaching a stage of neutrality where we know that relapse can even occur at that stage, and also preparing towards modification of those behaviors, and then finally adopting the new behavior. So these are some of the stages that you must also go through to be able to do that. However, we are also saying that behavior change in itself, there are certain factors that determine that behavior change. For behavior change itself to occur, there are certain factors that determine the behavior. And one of them is what? The thoughts and feelings of the individual self-image. That is your knowledge, your beliefs, attitudes, and values. And I spoke about this in terms of general behavior that I started when I started looking at the behavior itself. Your knowledge, which influence whether you want to change or not. Your belief practices or belief system in your communities. That is why you see even professors who go, and these traditional healers will give them some concoction to drink, because it's a belief that if you don't drink, something will happen to them. Even though they have a lot of knowledge, they have gone and learned a lot of things, you see them doing some of those things. You see a woman who has a score and have gone to school and know that somebody who died, you don't even know the sickness, there's no need to share the same meal with the person. But it becomes community belief. So she is thinking that if she do not involve, people will think that it's responsible for the death of the husband. And then the attitudes that we have, that's when we adopt them ourselves. We have mentioned some of them already. And then the values of the community. Marriage, naming ceremony, funeral rites, and all of that. Those things also determine the behavior, whether we change it or not. Then people who matter to us. There are certain significant orders and the motivation to be like them. That is why most of the time when you are doing advertising, or you see advertisement on TV and all that, now you know that Ghana Advertising Association, they have come against celebrities engaging in alcoholic adverts, because people want to be like them. So when they see them advertising alcohol, they presume that they are also drinking. And to be like somebody who motivates you, want to be like significant others, they also engage in drinking. So young people say, well, I saw this person smoking, and this person, I want to be like this person, this celebrity, and is smoking or engaging in this. Why won't I also do the same thing? Because they want to be like you. So that has brought a lot of changes when it comes to adverts in this country. So the significant others that we have, our friends, our family members, our schoolmates, our lecturers, our workmates, that we want to be like them. And those that motivate us. Things that they are doing that also influence our behavior. So automatically, don't be surprised if a child is smoking because the father is smoking. When they send them to go and buy cigarettes, sometimes they also try and start healing before bringing it to you. Or sometimes they say, well, go and light my cigarette and bring it. If you ask a child to go and light cigarette, what do you expect him or her to do? It's saying it from you. And you are his or her hero. So you copy from you blindly. Then resources, constraint. That is another challenge. There are people who naturally want to adopt behaviors that are help promoting, and yet the environmental factors or the resources are not at their disposal to adopt those behaviors, and therefore become problematic to adopt healthy behavior in those communities. And when we started, I mentioned something like KVI, people want to go to and do the thing in a very nice place, but however, they don't have the facilities. People want to eat well, but in the community, the food is not there, or probably because of poverty. So the resources are there. And that culture is also a so profound factor when it comes to behavior change. The perceived social norms that we have. Sometimes you see how people label people in their communities. When you try to do differently from what society is doing, they see you as an outcast, as if you are just dropping from somewhere. That is what is happening today when we have the surge in COVID-19. When you move around, you put on masks, people will be seen as if you just dropped from Mars. They don't see the need to put on masks any longer because they think there's no COVID. Here we are experiencing what? The third wave. So perceived cultural norms are also there. And then we talk about the cost-benefit analysis. Sometimes people want to look at what will be the cost-benefit analysis. What is it going to cost me to adopt this behavior? And what benefit am I likely to get from the behavior? And doing that, if you don't see clearly because of limits in knowledge, limits in all other things, then eventually don't get them adopting a very good behavior that will promote their health. So the cost-benefit analysis is something that also determines the behavior. Then the skills. Others do not even have the skills to change the behavior, or they don't have what it takes to adopt new behavior. So the knowledge bring about the change that we want to see in our society. We are saying the thoughts and feelings. And under that thoughts and feelings, that is self-image, we have mentioned the knowledge, belief system, attitudes, and values. Those are the things that influence the thoughts and feelings. When you look at thoughts and feelings, those are the factors and directions. And the people who also matter to us, the resources within the community, the constraints, the perceived social norms, the cost-benefit analysis, and the skills. All of these factors also determine the behavior of the people. So the modification of human behavior and the environmental factors related to that behavior, which directly or indirectly promote health, prevent illness, or protect individual from harm. So how do you modify human behavior and environmental factors? Because these are the two things that actually influence the behavior. The human behavior itself, how do you modify that? And also what? The environment. The behavior that we adopt, or our attitudes that we have adopted, the environment also influences that. So we are thinking of how to modify the behavior and also the environmental factors, so that directly and indirectly, they promote health and prevent illness among the people. An interactive process to develop messages and approaches for specific groups using a variety of communication channels to develop and maintain positive behavior. That can also be referred to as what? Health behavior. So when you have an interactive process to develop messages and approaches for specific groups, but using a variety of communication channels to develop and promote, that become health promotion we are talking about, that become a way of promoting your behavior. So the behavior change communication in itself, as we said, we are saying trying to modify human behavior, environmental factors that are related to behavior, which directly or indirectly promotes the health of the people. In other words, an interactive process to develop messages, approaches for specific groups. That is what we are saying that the reason why I mentioned specific groups here, if you remember, especially our weekends today, I was telling you that when you want to promote health, you must look at what? Things that are relevant to the group. And I know that if you bring adolescents together and elderly women, and you're talking about menopause, what do you expect adolescents to be at the lecture? They will leave. Because what is menopause? They are not thinking of menopause. They are trying to enjoy their youth. At the same time, when you bring women who are 60 years, you are talking about teenage pregnancy, they'll be looking at you some ways. We 60 years, you are talking about teenage pregnancy. So that is not relevant to them. So we are also saying that to develop specific groups using a variety of communication. So the approach must be suitable to the group that you are meeting. There are groups that like to watch videos. There are groups that like lectures. They like play. All of this must come on board. So it's to promote and sustain individual, community, and social behavior change. All the methods that you are using to bring about this behavior change we are talking about must be sustaining, must ensure that the behavior of people are maintained. So basically, you must look at all these channels when you are trying to develop an intervention to bring about